Hello, I'm Dr. Vicki Schnell from the Center of Reproductive Medicine. And in these times of the COVID crisis, it's good to reach out to our patients and the public and to inform them what's going on because only a limited number of our patients have been able to be in the clinic over the past month. And it's also good to reach out to you and hear from you. If you have questions after this presentation on telemedicine, then I will answer them at the end of this very brief little presentation. So one of the things that we've gotten questions on is about telemedicine and how this goes because it's all brand new and there's good things and bad things about it. So I'm new to FaceTime Live and I understand that the only way that you can really show like a PowerPoint is to put there, to put pages up, okay? Maybe that will change with time, but I think that'll work easier actually. Okay, so what can you expect out of your telemedicine appointment? I'll just kind of hold these up here and with time we can kind of go through it all. So first of all, it's good to be prepared for the telemedicine conference. Oh, this is funny. And so you'll have what is telehealth versus telemedicine? That was one of my big questions. Telehealth is when you do self-monitoring of glucoses and things like that. It includes telemedicine, but it is more inclusive of that. So if you're monitoring glucose, if you're getting patient education, if we're getting patient education, all of that is called telehealth. Telemedicine is the direct care between us, the physician, or the nurse and the patient, and you, okay? So that's what's included. What things aren't telemedicine? Things that aren't telemedicine are Facebook, this. I wouldn't want to counsel anybody on their healthcare. Number one, this isn't HIPAA compliant and it wouldn't be private. And number two, the information you get on there, as we all know, might not necessarily be as valid as you would from a physician or relied upon medical source. When did telemedicine start? Well, that's very interesting. I found out that it started with the astronauts in the 1960s because they were up in space and the only way that they could get medical care was to communicate with doctors through telemedicine. Also, it was later used for remote researchers in the Antarctic. In fact, there's that amazing story about the researcher in Antarctica who diagnosed herself with breast cancer. All sorts of things like that are the amazing history of telemedicine. What kind of appointments can you do in telemedicine? Well, number one, you can have a new patient appointment. We're doing appointments for lab reviews. We're doing pre-op and post-operative visit if it wasn't too extensive of a surgery. We're also doing what we call luteal consults if someone's in treatment. Also, if someone's had IVF, we're doing the consults at that point to review the findings, and if they've had their embryos biopsied, we're also reviewing the results of the embryo biopsy in a telemedicine consult. So another thing you would be for restart patients that haven't been seen and they just want to kind of check in and see what will be the next step. What kind of appointments can't be done this way? We can't see pregnant people. Pregnant people are urgent medical issues and they need to be seen in the office. We also can't do procedures like a dye study of your fallopian tubes or a test transfer or hysterosonography. We can't, of course, do procedures like egg retrievals, hysteroscopies, embryo transfers. It's unfortunate, it's not like Star Trek where we can be beaming embryos. We're not quite there yet on that one. The next topic is how to prepare for your telemedicine conference and consultation. Number one, you would call our office, 281-332-0073, and our call center would schedule you for this. You would need to install with Google Chrome the ability to access that, and you would need to place your phone on mute. It would be great if both you and your partner were available at the same time. One of the wonderful things about telemedicine is that you don't both have to be there. You could one person be in an office or remotely or in another city, and the other person be at home or in their office, which is pretty amazing. Another thing to be sure of is to be sure if you've been a patient that you also update your demographics and any of your history, such as you've had a baby in the past and you're returning for a second baby. Also, the medical records we use, you can upload your previous medical records into your patient portal. However, not everybody can do that, and so if you have medical records, you might do the traditional way of just faxing them to us. What to expect during the consult. Some of the things to expect during the consult would be a review of your history. This is also a time just to touch base to see how you're doing, how the COVID crisis is affecting you. We're here to support our patients, and part of that support is to kind of hear how you're doing and the stress of it all. So please feel free to share that. Telemedicine is HIPAA compliant and confidential, and so please feel free to do all of that. It would be good if you would sit down and make a list of your questions so that we can answer those and answer whatever questions you might have. It's also good to take notes. After the consultation, we will make plans for blood tests, semen analysis, and our clinical team, such as our nurses and medical assistants, will reach out to you either via video, secure medicine, or via telephone. Also, our administrative staff will reach out to you afterwards and discuss how your insurance plays in with all of this and how much is covered by your insurance. Then, of course, because the telemedicine is just this, it's like a video, there is so much more going on in the office before, after, and during that consultation. Your time is placed on my schedule in the computer. I get an email that confirms. It also alerts me like 30 minutes before that I need to get to the computer and sit down and get ready. We oftentimes will not just be the only person on here. Once we've done the initial consult, we might have a nurse or medical assistant come in and go over things with you also. We'll forward the orders to the team, and they will get back to you also. Also, prescriptions will be emailed now. We don't have to call them in generally. And one of the important things to provide in the beginning is your pharmacy number and the name of your pharmacy in the portal. If you need referrals, our administrative staff will help you get referrals for the initial consult as well as procedures and treatment plans and all of that. What are the benefits of doing telemedicine? Now that we've been in this, there are some good things and not so good things. Due to the COVID crisis, it's covered by most insurance companies and insurance policies. And the good thing is some of them are waiving copays for it, which is very nice. Again, it's HIPAA compliant. That it also provides more rapid scheduling. So if someone has an urgent need, we can schedule the appointment and discuss it and decide whether or not you need to be seen in the office in person or what would be the next step. It also doesn't require you to have COVID screening. However, we do recommend, because not all care can take place via this telemedicine consult, we do recommend that everybody wear masks and that they do as much self-isolation as possible. If you do have a fever, don't come into the office, of course, or if you have symptoms, do get tested. Another benefit is it's very ecologically sound in that you don't have to drive your car, and you don't have to consume the gasoline, although that's in plenty, but eventually that'll be an issue. it's more personalized. I know a lot of people feel more secure that they're at home and they're talking to their doctor. It's very hard for many patients to schedule their first new infertility consult, and sometimes the telemedicine actually makes it easier that you don't have to walk through those doors and say, "Oh my gosh, I'm in an infertility clinic seeing a fertility specialist." So many times that makes it easy. Many times it's more efficient because, again, if both you and your partner aren't in the same place, or the times we gave you weren't good, but we could do telemedicine at a time that is good for you, many times it's more convenient and efficient. It does provide more opportunity to talk to your physician for undivided time, when many times you wouldn't have, it would be at a time when you couldn't do that. And there's less COVID exposure. We don't have to worry about that. That's one of the reasons that we're doing it. We do miss seeing our patients, and it's good to see you on the video since we've all been isolated for a month. We as all your fertility specialists are all, oh boy, this is hard to do, all involved in this. I open it up to any questions that anybody might have. And thank you for being at my first Facebook chat. I have some questions down here, I think. Just people online. Let me see. I don't see any questions there. Oh, here. Anyway, so if you have other questions, you can certainly forward them to us, and we'll look at this again later. This is our website, and I wish you the best. Stay safe, stay healthy, and stay tuned. There are more events coming later today. Dr. Crochet is going to give a talk on health. There will be a giveaway on Saturday. We're so excited about that, and we're thrilled that we at least are able to celebrate National Infertility Awareness Week with our patients. And you have a great day, and wish you the best.